Hello everyone, today we're going to be talking about amoxicillin or Moxitag. Let's go ahead and start with patient education. Amoxicillin is used to treat bacterial infections, not viral infection. It's mainly prescribed for different types of infection, including sinus and chest infection, urine infection, ear infection, and some dental infection. You may also be prescribed amoxicillin to prevent an infection from occurring as well. How should you take amoxicillin? It can be given orally, intravenously, or intramuscularly. Amoxicillin comes in immediate release or extended release tablets. It also comes in a chewable tablet or a suspension. It may be mixed after thoroughly shaking and administered with formula, milk, water, fruit juice, or other cold drinks if given in suspension. Try to take it the same time each day. Take it with or without food, but you may take it with food if it causes an upset stomach. And to gain the most benefit, do not miss doses of this medication. And definitely finish your antibiotics. Take it until you finish, even if you're feeling better. Just some common side effects that you may experience with this medication. You may experience upset stomach, diarrhea, or throwing up. And it may be rare, but a serious side effect. Any signs of allergic reaction, watery diarrhea, and severe skin reactions. Now, for background, amoxicillin is in the class of beta-lactam antimicrobials. Beta-lactams act by binding to the penicillin-binding proteins that inhibit a process called transpeptidation. It's the cross-linking process in cell wall synthesis, leading to activation of autolytic enzymes in the bacterial cell wall. This process leads to the lysis of the cell wall, thus destroying the bacterial cell. This type of activity is referred to as bactericidal killing. Now for indications and dosing, amoxicillin is one of the most commonly used antibiotics in the primary care setting. It is an aminopenicillin created by adding an extra amino group to penicillin to battle antibiotic resistance. Amoxicillin covers a wide variety of gram-positive bacteria with some added gram-negative coverage compared to penicillin. So the first indication we have is streptococcal pharyngitis. You may use 500 milligrams twice daily or 1 gram once daily for 10 days. Then we have otitis media. You may use 500 milligrams every 8 hours or 875 milligrams every 12 hours. For 5 to 7 days for mild infection, and then up to 10 days for severe infection. And then we have rhinosinusitis. You may use 500 milligrams every 8 hours or 875 milligrams every 12 hours for 5 to 7 days. And then we have skin and soft tissue infection. For erysipelas, we have 500 milligrams 3 times daily or 875 milligrams twice daily for 5 to 14 days. And then we have erysipeloid. You may use 500 milligrams 3 times daily for 5 to 10 days. And then we have community-acquired pneumonia. You may use 1 gram 3 times daily for empiric, and if you want to do a step-down therapy, you may use 1 gram 3 times daily for a minimum of 5-day therapy. And then we also have UTI. For asymptomatic, you may use 500 milligrams every 8 hours or 875 milligrams every 12 hours for 4 to 7 days. And then if patient has cystitis, then they may use 500 milligrams every 8 hours or 875 milligrams every 12 hours for 5 days. And then we also use amoxicillin for H. pylori eradication. So for clarithromycin triple regimen, we have Amoxicillin 1 gram twice daily in combination with clarithromycin 500 milligrams twice daily, plus your standard dose or double dose of PPI, and then continue this regimen for 14 days. Note: avoid use in patients with risk factors for macrolide resistance. Now for the concomitant regimen, we may use amoxicillin 1 gram twice daily in combo with clarithromycin 500 milligrams twice daily, and also with either metronidazole or tinidazole 500 milligrams twice daily, plus your standard dose of PPI twice daily for a regimen of up to 10 to 14 days. Then we have your sequential regimen. You may use amoxicillin 1 gram twice daily plus a PPI twice daily for 5 to 7 days. And then another option, which is your hybrid regimen, for amoxicillin 1 gram twice daily plus a standard dose PPI twice daily for 7 days, followed by amoxicillin 1 gram twice daily with clarithromycin 500 milligrams twice daily, and either metronidazole or tinidazole 500 milligrams twice daily, plus your standard dose PPI twice daily for 7 days. So total of 14-day regimen. Then we have your levofloxacin triple regimen, which is a salvage regimen. You may use amoxicillin 750 milligrams 3 times daily in combination with a double dose PPI twice daily, plus levofloxacin 500 milligrams once daily, and continue this regimen for 14 days. And the last one is a high-dose dual therapy, which is an alternative salvage regimen. You may use amoxicillin 750 milligrams 4 times daily or 1 gram 3 times daily, and this in combination with a double dose PPI twice daily for 14 days. And then we can go on ahead and talk about off-label indication use for amoxicillin. You may use amoxicillin for actinomycosis of 500 milligrams 3 to 4 times daily or 1 grams 3 times daily, a duration of 2 to 6 months for mild infection and up to 6 to 12 months for severe infection. You may also use it for anthrax, depending if you for inhalation exposure. You may use 1 gram every 8 hours for 42 to 60 days without vaccine, and for cutaneous exposure, you may use 1 gram every 8 hours for 7 to 10 days. Then we have asplenia prophylaxis. You may use 500 milligrams twice daily, and then bronchiectasis for pulmonary exacerbation. You may use 500 milligrams 3 times daily, or 1 gram 3 times daily for up to 14 days. And for prevention, you may use 500 milligrams twice daily. And then for cervical infection in pregnancy due to chlamydia, you may use 500 milligrams 3 times daily for 7 days. And then for endocarditis prophylaxis, you may use 2 grams 30 to 60 minutes prior to the procedure. And then we have Lyme disease for erythema. We have 500 milligrams 3 times daily for 14 days. If you have carditis, it's 500 milligrams 3 times daily for 14 to 21 days. And if it's arthritis without neurologic involvement, you may use 500 milligrams 3 times daily for 28 days. And then for periodontitis severe plaque associated, you may use 500 milligrams every 8 hours plus flagyl for 14 days. And then for prosthetic joint infection, you may use 500 milligrams 3 times daily. Now for dose adjustments, In renal patients with impaired renal function do not generally require a reduction in dose unless the impairment is severe. So severely impaired patients with a glomerular GFR of less than 30 milliliters per minute should not receive an 875 milligrams. And then patients with a GFR of 10 to 30 milliliters per minute should receive 500 milligrams or 250 milligrams every 12 hours, depending on the severity of the infection. And then patients with a GFR less than 10 should receive 500 or 250 milligrams every 24 hours, depending on the severity of the infection. Hemodialysis patients should receive 500 or 250 milligrams every 24 hours, depending on the severity of the infection. They should receive an additional dose both during and at the end of the dialysis. Now for adverse events, the common adverse drug reaction. Amoxicillin is well tolerated, but some common complaints can be GI symptoms such as nausea, vomiting, and diarrhea. And for significant adverse event, we have C. diff infection or CDI. Mechanism, it's usually dose and time related. It's related to cumulative antibiotic exposure. Amoxicillin may cause disruption of the intestinal microbiota, resulting in the overgrowth of pathogens such as C. difficile. Onset varies. It may start on the first day of the antibiotic therapy or up to 3 months post-antibiotic. And then some risk factors includes antibiotic exposure, types of antibiotic that was used, clindamycin, carbapenems, and third-generation cephalosporins amongst the highest risk. And then long durations in a hospital or other healthcare setting, older adults, immunocompromised conditions, a serious underlying condition, GI surgery manipulation, or anti-ulcer medications such as PPIs and H2 blockers, or patients with undergoing chemotherapy. Then we have hypersensitivity reactions, immediate and delayed, ranging from skin rash to rare cases of anaphylaxis. So with mechanism, it's non-dose related, it's more immunologic. Immediate hypersensitivity reactions are IgE mediated, and delayed hypersensitivity reactions, including rash, are T-cell mediated. Onset, it may be immediate hypersensitivity reaction or delayed hypersensitivity, usually occurs about 7 to 10 days after initiation, and then sometimes it occurs up to 8 weeks after initiation. Risk factors include cross-reactivity between penicillin and cephalosporins, and among cephalosporins is mostly related to side chain similarity, such as cephalexin, ampicillin, and amoxicillin share an identical or similar side chains. And then we also have antibiotic diarrhea. GI effects range from antibiotic-associated that are non-C. difficile related diarrhea. And then the mechanism, it's dose and time related, antibiotic disruption of indigenous gut microbiota. And then the onset varies. Mean time to onset is 3 to 18 days for adult patients, and then 2 to 6 days for pediatric patients. And then for risk factors, it's less common with amoxicillin or ampicillin alone than with amoxicillin combo with clavulanic acid. Duration of therapy, age, length of ICU stay, duration of PPI use, and combination of antibiotics. And that's my presentation. Thank you for listening.